Good afternoon. This is Ana Fadich with Men's Health Network, and we are here with Dr. Arthur Evans Jr. of the American Psychological Association. And we just finished a briefing on boys and girls' health and the CHIP program. But what we want to know is, what are some of the stigmas and barriers for men accessing mental health care, and what kind of access issues are there?
Yeah, well, thank you for doing this. I think men's mental health, boys' mental health is very important. And as you say, there are generally stigma associated with having a mental health challenge or having a substance use challenge. And for men, I think it's particularly a challenge for several reasons. One is that often men don't have the language of emotion. And so when you're talking about treatments that are primarily about talking about how you feel, often that's foreign for men, and so it creates one of the barriers. I think in our society there is a strong sense of strength and for men, and often having a mental health challenge is viewed as a weakness when it shouldn't be. Having a cardiac problem, having diabetes isn't a sign of weakness, it's a sign of having a physical challenge. In the same way, that's true for men and having mental health challenges. So I think one of the things we're very interested in at the American Psychological Association is breaking down that stigma, using innovative ways to have conversations with men about mental health challenges, and making sure that men and boys have access to mental health care.
So this to me sounds like we should be working with our young men, our young boys from an early age, so that we try to avoid having this problem later on in life. Are there different things that parents might be able to do, or that schools are currently, what kind of programs do schools have that might help boys in talking about the issues that they have?
Sure, that's a great question. I think modeling is very important, and modeling, particularly for young boys, the ability to talk about how one feels is very important. In lots of cultures, including in our culture, often we look at boys who are experiencing difficulty and say, well, you got to kind of suck it up. And the reality is that all of us go through things that it's important to talk about. So I think modeling is very important. One of the things we were doing in Philadelphia, which was unique, it was because we were trying to get men to talk about these issues, is we worked with storytellers in the community, professional storytellers, identified men who were willing to talk about their stories, got professional folks to work with us, and then did programs where people would get up and they would talk about going through depression or going through trauma, and then we would talk to the community afterwards. Very interesting. First time we did it, we had 300 people. The next time we did it, we had 600 people. The next time we did it, we had 1,000 people. Words of mouth spreads, but what was interesting about that is that the community was ready to have that conversation. So even though there is stigma, I think there's also an understanding that this is an issue that we have to talk about, and we create innovative ways of talking about it. People are ready to have that conversation.
I definitely think that if we're fostering that within the home environment, and then we're also helping the schools in fostering that, I think it'll go good in the long run, thinking about how our boys will turn into men. For girls, we talk about everything. We'll express every emotion that we have, but as you had said, from the young age, we're teaching our little boys, big boys don't cry, suck it up, it's okay, don't talk about it.
Exactly.
So then they take that with them throughout life, and it gets to be to a point where they're suffering from other physical health conditions, headaches or getting ulcers or anything like that, because they're holding so much inside.
Yes.
So is there anything that you would like to tell the Men's Health Network viewers for around behavioral health issues or mental health, specifically to these men that are out there watching?
Right. Well, what I would say is, one, I think it's important that our physical health and our mental health are one, that they're not really separate. And that people should be willing to seek out help. Now, one of the things we know is that things like social support are very important in terms of our mental health. And so sometimes we don't need to go to a professional, which can be intimidating. Sometimes this is about talking to people who are in our lives. And again, you need to have some people in your life who you're willing to talk to and able to talk to about those deep things, about those feeling things. So I think people having that option, I think is really important. The other thing is that, there are really great websites out there, apa.org, which is our website for the American Psychological Association. There's a lot of great information about resilience for children and trauma and stress and managing stress. Reach out, look at that information. It can be very helpful. You don't have to necessarily go to a mental health clinic. There are lots of ways that people can get help for these kinds of issues.
I think that sometimes that's the whole stigma behind it, is that I don't want to go to the doctor. This isn't a topic that I need to go to the doctor for. And we rely a lot on the family, the women in their lives, whether it's their mother, their sister, their wife, to come in and speak to their loved one, because no one knows you like the people that spend the most time with you. So if they notice something is a little off in your demeanor, maybe you're not as happy as you were last week, maybe there's some problems there. And so to encourage them to speak, because we always want to try to get men to speak more.
Yep.
And we tell women, you have 2 ears and 1 mouth, so if he's talking to you, make sure that you're listening to what he has to say. Thank you so much for coming and joining us today. Thank you for your words to everyone who's watching, and we really appreciate everything that you do.
Thank you. I really appreciate being here. Thank you.